not to wait till the last minute. A lot of the times, the caregivers get very frustrated, and they suddenly give up, and they think the answer is to just bring mom or dad either to an emergency department or to a nursing home and say, here, I've had enough, I can't take care of them anymore.
Yeah, and strangely enough, there has been a pattern which is developed nationwide because you can't get into a nursing home often, or they will give you a lot of nonsense and red tape. So people take mom, wheel her into a library somewhere, and leave her there.
Well, actually, it's not as difficult.
Grandma dropping.
Well, they've been doing that for years, Reed.
Yeah.
For as long as I can remember working in the emergency departments. But the thing is that the process is a lot easier these days. There are wonderful people, especially we're very lucky here in Chautauqua County. We have an excellent Office of the Aging. We have an excellent Department of Social Services, and those are the people that will help you with the Medicaid application. Medicaid, as you know, is really the only insurance that pays for a long-term stay at a skilled nursing facility. And they make a difficult process as easy as it can be, and it's a very complex process, but that's not of their doing. That's because of the federal government and the state government and the documents that they require and things like that. They will work with you. They give you all the information that you need. What you need to remember is that you need to be honest with your application and bring to them everything that they're asking for. Otherwise, they can't help you. They are busy, so if you were to call on Monday and say that you need an appointment, you'd like an appointment for an application for Medicaid, it may take up to a month to get in there, but they will get you in there. In the meantime, they send you the information that you need to bring with you so you're not wasting each other's time.
And also, you probably wouldn't be going in yourself. In most cases, at this point, you're being taken in by somebody because, as a matter of fact, most people that I've discovered who go in for Alzheimer's, a lot of them do, don't even know they're there. They're not sure where they are. So.
Well, that's where pre-planning comes in.
Right.
It is so important. You know, as my background being in the emergency medicine, the sentiment is, you know, poor planning on your part does not constitute an emergency on ours. If you know something's going on, then you need to plan ahead, and the time to plan ahead is before something's going on. So everybody knows, God willing, that they're going to get older. So you need to estate plan. You need to, if you want your house and your property to go to your children or grandchildren, then while you are still healthy, you should get that property out of your name and put it into your children's name.
Good advice. Well, we got a couple of calls. You want to take a call?
Sure.
Hey, good morning, caller. Thank you for waiting. Hello there.
Good morning.
Good morning.
I have a question or two about nursing homes.
All right.
In my experience, there was one nursing home, or perhaps two, where obviously it was not a very healthy environment. It was just not entirely healthy. The patients weren't looked after often enough for their hygiene, and it was obviously not the kind of environment I would want for my parents, for example. I was wondering who regulates the quality and the whatever, how well they are being run.
I think you're asking the right person.
Regulates nursing homes.
You're asking the right person. Okay.
All right. All the hospitals and skilled nursing facilities, nursing homes, are all overrun by the New York State Department of Health. They have very strict rules and regulations about how things should be. One of the things that is so important that I tell people to do all the time is, don't take my word for it that, you know, I think that my place is the best, Absolute Care of Westfield. Go visit it. These are loved ones that you're going to be sending there either for rehab or for vacation stay or for long-term care, you need to go and take a look at the place. You need to meet with the people. You should speak with some of the residents that are long-term care. You should seek out people that have had rehab there and ask them about what their experience is like.
Mingle with them.
Exactly, absolutely.
You know, Dave Reynolds, who runs the Westfield House, does a fabulous job.
Yes, he does.
I think it's the best one around.
I think so too.
He once, I said, what's the most important thing when you walk into a nursing home to give you a clue as to how they run it? He says, smell. Smell it.
Exactly.
He said, if you get bad odors, you know it ain't run right. And if it smells sweet and good, it's probably being run right because it leads from there.
Exactly. The other thing that you always want to do when you go into a skilled nursing facility is see how the staff intermingles with the patients. You know, if you go in and you see the staff people and they're just walking down the halls and they're not looking or greeting or meeting with the residents that are there, I certainly wouldn't have anything to do with that place.
Yeah, it's like at Walmart. They
exactly.
say if you have eye contact with somebody, talk to them. Say hello.
Sure, absolutely. And as you mentioned earlier, senior citizens love to have people visit. It doesn't take but 2 minutes to stop and say, hi, how are you? How is your day going? And things like that. But if you find that there is a problem, if you have a loved one in a nursing home, then you should bring your concerns to the administrator of that facility. That's the first place you go to. If you find that they are not responsive to your needs or you fear for the care of your loved ones, then the next step is usually calling the Department of Health if you're really that worried. But usually it's easily solved on the local, right there at the facility, if you happen to bring up whatever your concern is. You know, sometimes other people see things differently than you do. You need to make sure that that you discuss what's going on. They can't read your mind. If something is irritating you or you think that there's something not right or they're not treating your loved one the way they should be treated, then first start with the nurse that's in charge of that unit, speak with the director of nursing, or speak with the administrator. A lot of the times things can be very easily straightened out if you just say something.
There you go, caller.
Well, I'm not satisfied.
Okay, well then.
Mike, I want to. I understand what you're saying, and that makes sense. You must remember that we are the lay people in this case, and other people are the professionals. And my question is, how often will an inspector or someone visit these places? Because as a offspring of some elder person, you leave it up to the establishment, and maybe you have to travel some distance to visit them. And answer me the question, if you can, how often does the authorities check these?
The Department of Health will come in. They come in once a year. They come into every skilled nursing facility once a year. They review the charts, they look at the patients, and it's all random. So the staff has no idea of whom they're going to be asking about. And then if there is a complaint that is called into the Department of Health, then they will come in at that time as well.
Don't you have ombudsman also?
Yes. Yeah, that's the other people that you can speak with is all skilled facilities have got ombudsmen that are there. They are there for patients' rights, and they are lay people. They are not medical people.
All right, who are these? Where are these people, and how are they available? And
of course they're available. You need to ask anybody. You could ask the nurse that's in charge of the unit that your relative is on, that you want to speak with the ombudsman of the facility. They will contact them for you, and they will get them in touch with you.
I see.
They are the patient representatives for those that cannot speak for themselves and for those that can. They always go around. They are there. I know ours are there almost every day, going around speaking with patients, making sure everything is fine, and intervening on their part if there's something that they would like to have changed or different.
Okay, thank you, caller.
One more thing.
Sure.
The ombudsman how do you pronounce it?
That's right.
Representative of the patient, so to speak.
Mm-hmm.
How much authority do they have? And
They have a lot of authority.
They can bring the house down, caller, if they wanted to.
I see.
I mean, they go